Well, the virtual teaching hospital system is a medical education support tool, and it is essentially a tool for facilitating small group learning. The presentation that we're making is with Marriott, Dipesh, Brian, and Faith. Well, it's not in there. Okay. We are focusing essentially on the respiratory system, and we're going to use it, the virtual teaching hospital system, to carry out a clinical problem-solving exercise in which we are going to do diagnosis of 2 patients. We'll also continue to do literature search on the patients that will have been diagnosed. Then, basing on that literature, we'll give a feedback to the family regarding the illness of the patient. Now, the virtual teaching hospital system has evolved over the past 28 years. It initially started as an initiative to create a tool that would support junior doctors in patient clerking. But over the years, it has evolved into a medical education support tool. The virtual teaching hospital system has specifically been adapted for now to the Leicester Medical School small group learning process that it will facilitate. This has been done to make it appropriate for for supporting teaching and learning at Leicester Medical School. One may ask, why was the virtual teaching hospital system adopted to the Leicester Medical School small group learning? It has been done so because at that medical school, small group learning is the main strength of teaching. It allows close interaction between medical students and the teaching staff who are facilitating on the topic. And students have actually expressed good satisfaction regarding the system of teaching and learning. In this current demonstration, we are presenting it as a tool for supporting problem solving in a clinically oriented assignment. We did that because at the request of Leicester Medical School Medical and Social Care Education Department, we were asked to context the system to that process. In medical education and any other teaching process, one critical parameter or feature is the pedagogy. Now, the pedagogic process is the art or science of teaching. The pedagogy is the most fundamental feature of any teaching and learning system. It is the feature that any educationist would want to know if you talk about a teaching and learning support tool. So in the Well, I now present you with the pedagogic protocol as agreed between the design team for the VTHS and the social and medical education care department of the medical school. Now, in a recent feedback, we were asked to make some adjustments to the original pedagogic process that we had drawn up. Some more details are yet to come. Otherwise, for now, the demonstration that will show you captures the essentials of that pedagogic process. Now, in comparison to the VTHS, there is another program called D-Explain. Now, the main difference or weakness that we see in D-Explain is that there is no clear pedagogic process in the tool that the D-Explain D-Explain does not have a pedagogic process which is clearly demonstrable. As such, we feel that it's not a very appropriate tool to support teaching and learning.